Welcome again, Dr. Alan McCord from Kent East Chiropractic, and we're going to be launching our next episode here right now on Ask Dr. McCord, which is a continued series of educating you about health issues that chiropractors can help you with. And today, we're actually going to be talking about a condition called sciatica. And sciatica is a difficult term for some people to pronounce, and what it really has to do with is the sciatic nerve. And of course, you know that your body is run by the brain and spinal cord and all the peripheral nerves that come out of the spinal column or vertebral column. And the sciatic nerve is the largest and longest nerve in the body. And actually, you can see on this poster here, the spinal nerve distribution showing nerves that go up into the head and the upper neck and then all the way to the different levels going to all different parts of the body. So those in the lower neck and upper back going down the arms, and then these here in the lower back going down the back of the legs. The sciatic nerve is actually the largest nerve in the body, and it comes out of the peripheral nerves in the lower back region or the lumbar spine and courses down the back of the leg all the way down through the foot to the ankle, or the ankle and foot, and then obviously the toes. And any condition or any interruption to that nerve would cause what's called sciatica. Sciatica basically is symptoms of, it could be sensory, it could be numbness or tingling. It can be also motor functions, where you can have weakness of a muscle, weakness of your legs not working correctly. And it's typically in one leg, but it can be down both. And the kind of symptoms that people report with sciatica can be everything from sitting issues, being able to sit comfortably, standing for a long period of time, of course, driving, walking, running, doing exercises. Those kinds of things are typically the symptoms that can manifest with a condition called sciatica. It's usually position related. So people can complain of having leg pain when they're sitting, but if they stand, it can feel better. Or if they're walking, it can feel better. It's usually can change like that depending on the position. And what causes sciatica? Typically, there's a number of causes, but the primary one that most people can deal with is what's called sciatica from a disc issue. And the disc are the pads of cartilage here in my spine. You can see a pad of cartilage which is going in between the vertebra. And the disc can actually, due to physical impacts and stresses, can bulge, putting an irritation on the nerve as it comes out and causing reflex or radiating pain going down the legs. By the way, also it can affect your reflexes. That has to do with the spinal cord reflex. So chiropractors treat this. Obviously, you can go to a medical doctor, and typically medical doctors with sciatica condition can be recommend, of course, drugs to deal with the pain. They can typically recommend physical therapy, which can be helpful. If those things don't work, they go to epidural shots, which are injections into the back to try to reduce the size of the disc bulge as well. And then ultimately, if a person needed to have surgery to remove the disc, like we showed you here in this example. So in extreme cases, that's what would probably be recommended. There's been literally hundreds of studies done on the effectiveness of chiropractic in comparison to other types of physical care. One in particular was they found 44 workers, within 21 days under chiropractic, utilizing that approach, 91% of them returned to their work. So very, very successful. Chiropractic is usually most successful when it's first, if you have sciatic conditions, that it's the first approach that you go with. And we treat sciatica many times in our office, not only just with adjustments, adjusting the spine, correcting the misalignment, but we use a care called non-surgical spinal disc decompression and have since 2006, and literally have had hundreds, if not thousands of patients report with sciatica. And many of those people had surgical consults. They were scheduled for surgery. They were going to do surgery, and they came and saw us and got a tremendous amount of relief. We have about a 93 to 95% success rate in doing our procedures. Not only do we do the adjustments, but we also do the decompression work as well as therapy and at-home exercises to help resolve this condition. And what we find is people just want to get their life back. They don't like sitting with pain. They don't like not being able to work out, these kinds of things. And we can help dramatically with that. So hope this addresses that for you. And if you've know family or friends that are dealing with that, certainly want to encourage them and refer them in. Make sure you go check out our website, which is kenteastchiro.com. And then make sure you go check out the rest of our episodes of Ask Dr. McCord on our YouTube channel. That's again, Ask Dr. McCord. Thanks for joining us and hope this was informational. Have a great day.